The Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. Welcome to another episode of Healthy Desert, Healthy You. My guest today is none other than Anyse Smith. Anyse is the newest member of the Desert Healthcare District and Foundation Board of Directors. Anyse is also an attorney with Starting Over, which is a nonprofit housing and legal aid organization working with unhoused people in Riverside, San Bernardino, and Los Angeles counties. Welcome, Anyse.
Thank you, Will. Glad to be here. Thank you for the invitation.
I'm so excited to chat with you. You have a very unique perspective being on the board. I think at the time of this recording, 5 months into the job, right?
That's right.
Yeah.
That's right. January, right.
I want to go back a little bit. Well, a little bit? I want to talk about where you grew up, where you were born.
It's a long bit now, actually, funny enough. So, I grew up in California. I grew up in the IE, and, I was raised in a family of healthcare providers, actually. My father is a physician. My mother was a nurse. And in fact, even today, my younger sister is also a physician practicing in infectious disease. And so, I grew up in the suburbs, very familiar with the IE. This is my home for a long time. And so, I've lived in the Coachella Valley now for a little over 12 years, but the majority of my life I have lived in California and in the IE. And so, this is home for me, and what happens here is important to me as well. So,
right. Absolutely. Glad to hear that. A native Californian.
That's right.
Great to have you on here. And the fact that you come from a family of healthcare providers, so the topics that the board discusses, that's really not new to you, the things that come up.
No, when you grow up with a doctor and a nurse, and at the time a future doctor, you kind of get used to the conversations and hearing about, what the challenges were as providers. And so for me, even though when I got older, obviously decided to go down the legal path, I've always had a very deep appreciation for individuals who work in the healthcare sector, because I understand how challenging it is, but also how rewarding it is, providing care for someone who may be in one of the most difficult positions, that they can be in their life, and to do so in a way that provides dignity and care. And so that was one thing that was definitely always imparted upon me by my parents, and that, I try now to impart upon others.
Tell me a little bit about the reason why you wanted to be an attorney. And not just an attorney, you are an attorney in the nonprofit sector, those organizations that provide the type of care that you're talking about.
Sure. Yeah, I definitely didn't always want to be an attorney. Some would say, due to my penchant for, arguing and speaking up about things that, that are happening, injustices, speaking up about them, I definitely, am known for doing that. However, I actually did not decide that I wanted to be an attorney until sometime around 2014, 2015. And at the time, I was working as the housing manager at the Coachella Valley Rescue Mission. And I remembered that we had participated in helping to rehome folks who were at an encampment off of Highway 86, I believe it is, there in Coachella. And it must have been, at least 100 people who were all unhoused. They're living, on the side of the freeway. And Caltrans was coming down, and they were saying, because it was Caltrans land, they were saying that they needed for people to move. And so this became a very urgent situation, because now we needed to find someplace for over 100 people to go within a very short period of time. And I remember thinking at the time, as a housing manager, I was very used to doing street outreach, housing navigation, trying to help connect people to the services that they needed so that they could improve their situation and their lives. And I remember thinking, a few times certain situations came up that really would have required legal expertise, right? And I didn't have it at the time. That wasn't my background. And I had a really hard time finding somebody who would take these kind of cases, typically for folks who could not, of course, afford an attorney. And so I think that was for me a kind of a light bulb moment where I was like, you know what? Maybe I should go to law school and then I can provide the services to people that right now I'm not seeing others are available to provide in the Coachella Valley. And that's when I decided to go to law school.
Oh my God. So that's quite a huge commitment, a huge undertaking, but you saw a need and you went for it. Is that your MO? Is that your style, would you say?
Some would say that. I am a very strong believer in once you identify an issue, you see a problem, you try to be part of the solution. And that doesn't look the same for everybody, right? I don't think there's any real expectation that everybody go, and do street outreach or everybody go and do a particular thing, right? The beauty in collaboration is that we all do different things that are within our strengths and our abilities to do to help be part of the solution. And so for me, becoming an attorney was being part of the solution of making sure that for folks who are often marginalized, overlooked, and in a position where they cannot afford to get the justice, right? They don't have the access to justice that others have. Being part of the solution, at least at that point for me, was going to law school and becoming an attorney. And I'm very proud today that as an attorney for a nonprofit organization doing legal aid, that is exactly the work that I do.
And I must say that we're very proud to have you on the board.
Thank you.
At a recent meeting, I think you made a joke about you're an attorney, so you're going to have very thoughtful comments, in-depth questions. So I think that's a great thing. It's a great asset for the board.
Thank you. Yeah, that was my disclaimer. I was presenting a report, and so I have to do it the way I know how to do it, which is point by point to make sure to be as thorough as possible so that people can understand what's happening.
So I always ask the guests, how and when did you first hear about the Desert Healthcare District and Foundation?
I don't remember exactly when I first heard about the healthcare district, but I can tell you it must have been back when I was working at the rescue mission, for years. I guess I could say that, kind of as a provider at the time and working for a nonprofit, we were all kind of in the same ecosystem, right? And the Desert Healthcare District and Foundation has been a long time supporter and promoter of local institutions here in the Coachella Valley who are providing services, particularly to our most vulnerable communities. And so I feel like I've just almost always known about the Desert Healthcare District and Foundation. I've just always kind of known about it. I know I had the opportunity to meet staff like Donna Craig over the years and, at various events and things where we would all come together, and we did tours at one point of various shelters and different providers, their offices in the desert, so that we could expand our collaborative efforts, right? And de-silo a little bit, not always be working all separately from one another, but be working together. And so I think that that's how I became familiar with the Desert Healthcare District. And I've always had an awareness, but also a deep respect for this organization and the constant work that has been done to make sure that, support is being provided where it needs to be provided.
Exactly. So tell me about the decision to run for the board, to run for the board. I know you were appointed.
Yeah,
and
I was.
The election is coming up in November 2026. But what prompted that decision to apply for the appointment?
Sure. So I actually, a couple of friends of mine called me and said, oh, there is a vacancy on the board for the healthcare district, something you should look into. And I thought, okay, it probably wouldn't have occurred to me on my own to do that. But I said, all right. So I did a little bit of research, and I thought, well, when I got more information about the work that the healthcare district does, because like I said, I knew just as, a community partner, but when I really, really looked into, and got on the website and did a bunch of research, I thought, this mission to make sure that healthcare access is available to everyone in the desert, and that, equity, right? The emphasis on equity was something that really spoke to me. And so I said, you know what? I'm going to just try it. I'm going to go for the appointment and just see what happens. And I'm glad that I did that. I feel very, very honored and blessed to be a part of the board today. And, just looking back to, I guess you could say, December 2025 until now, I really do feel now, especially that I'm on the board, that it is such a privilege to be in a position to help. We're trying to become a healthcare system amplifier. To be able to help and be part of that effort is very special to me.
Oh, yeah, absolutely. I remember the day of the applications or the interviews, there were quite a few applicants.
Yes.
How were you feeling that day? Because I believe you actually knew some of the other applicants, right?
Yes, I knew most of them, actually. Folks I've known for years, and we've worked together on so many different things. So I was very happy, actually, when I saw who else was being considered for appointment, because I thought, these are folks, and like I said, I knew the majority of them, not everybody, but these are folks who have been doing good work here in the desert for a very long time. They're ethical, they're smart, they're compassionate. And I thought, you know what? The district is going to be in good hands if any of them get selected. And so it was like a little reunion, honestly. It was a mini reunion that day. And I think that just speaks to the reputation of the healthcare district that, when there was a vacancy, folks of that caliber from the community were actually interested in applying for that appointment.
Right. So let's talk a little bit about actual board service. I think it looks like one thing from the outside, but once you're on the board, what has your experience been like?
Well, once you're on the board, I will say this, there is a lot to learn. And for me, I kind of just jumped right into it. When I was appointed in January, you all were already in the midst of strategic planning. You'd been at it already for a few months. And so I really just kind of got right in there. And I had a lot of catching up to do. There was a lot of reading to do. I had a lot of questions to ask. I was very grateful to the staff because everybody was very kind and very patient, making sure that if there were questions or if things needed clarification, that was provided. And so I would say that really the scope of what the healthcare district does, the interconnectedness of healthcare, and social determinants of health, it really touches so many different aspects of what's happening here in the Coachella Valley. And I would say probably more so because, it's not just about, and very importantly, it's about access to healthcare, right? Providers, but it's also about making sure that folks have the information, right? It's about transportation. It's about housing. It's about environmental factors. It's about all these different things all at the same time, right? It's a very big job. And I think that the healthcare district is very well equipped to take on those challenges that are presented here in the Coachella Valley.
Right. All those social determinants of health as well.
Yep. Mm-hmm.
Yeah. You mentioned earlier that we are, say, evolving, but taking on more of a health systems amplifier role. And that's part of the strategic plan. What about the new strategic plan really excites you?
Well, the first thing that excites me about the strategic plan is the fact that it is informed by the community, right? So we did those forums. We did 7 in-person forums. We did 1 virtually, right? I think it was over 230 people who participated in these and almost that same amount of people who completed the survey. And so we really ask these questions of the community, like, what is it you see that needs to be changed? What is your experience accessing healthcare? What can be done better? How do you find out about these things, right? What do you know about the healthcare district? And so I love that the strategic plan is so strongly informed by community voices, because for me, I've learned it's just so important to lead with community voices, right? We need to know, because this is a public agency, right? It's a special district. And, I would say our objective is to make sure that the community is benefiting from the services that we provide, the support that we provide. And so for the strategic plan, I'm just really, really excited, very enthusiastic about the direction that it's going, because we really have the opportunity to make generationally transformative change here within the Coachella Valley and beyond as a health system amplifier. And so it means so many things, right? But we heard a number of things from the community, like we need more providers, right? We need better transportation. Folks don't want to have to wait months for an appointment, right? They don't want to have to go out of town just to see a doctor. And what is the benefit of having all these services if people don't know where they are or how to access them? And so we talked a lot about that. And I think that the strategic plan is very intentional with covering all of these various aspects of things that we heard from the community and then reflecting them back. So we make sure that when we set our goals, our priorities, and our tactics, how we're going to get it done, it was all originally informed by what the community wanted.
Absolutely. And that was really, it was a lot because a lot of those meetings occurred in the evening or on the weekend. And it was totally worth it just to hear from the community. And
Absolutely.
As you said, what their priorities are. And I want to share with our viewers that the new strategic plan, which was approved by Anyse and the rest of the board on May 26th, is actually posted on our website, dhcd.org. So you can go and you can read all about it. And you can submit any questions you have to the staff at info@dhcd.org. So Anyse, I want to ask you, because you have a very unique perspective about life in the Coachella Valley. Can you talk a little bit about any misconceptions about life in the Coachella Valley and, people who don't live here, they hear about Palm Springs, they see the beautiful images. What would you say to those people?
Right. Well, very often, to the point you're making, folks know about Coachella. They know about Palm Springs. It's a fantastic tourism location for many. And we have, people here and communities here that are not quite as well off as some folks may assume that they are. We have a very wide spectrum of people. We have very wealthy people, and then we have very economically disadvantaged communities here. We have folks who are unhoused, a number of folks who are unhoused right in the community. We have two of, and I would argue, the best shelters in the county, if not the state, between the Coachella Valley Rescue Mission and Martha's Village and Kitchen operating right here in the Coachella Valley. And so I think that the disparities, and it seems that those disparities unfortunately seem to be growing between, those who have a lot and those who may not have as much. And I think, for me, being a formerly unhoused person, a justice impacted person, I went through the program at the Coachella Valley Rescue Mission. I myself am in recovery, and part of the recovery community here in the Coachella Valley. And so by virtue of my personal experience, but also my professional experience, doing street outreach, helping people find housing, it's really challenging. It's really challenging out there. Imagine if you're an individual who's on Social Security and you're trying to find an apartment, but your Social Security is $900 a month, right? You can't afford an apartment that way. Maybe you could afford to move into low income or affordable housing, but those wait lists can be years long. And so you have a lot of challenges for people. You have families with young children. We have a shortage of pediatricians here in the desert. And so you have families with young children who can't necessarily get the care that they need. Childcare is very expensive. And so there are a number of things. Food insecurity is huge here in the Coachella Valley. Thank God for Fine Food Bank and other organizations who are providing food to communities that need it. And so there's a lot happening here that I think often gets overlooked. But for me, it's a major driving component to why I do the work that I do, because coming from the standpoint of someone who needed services myself at one point in my life, and now being on the other side of that as a service provider, we often work with these communities who are overlooked, right? You have so many people who are employed, but living in their car, right? They're kind of, a group of individuals who are often overlooked because they're not visibly, right, located on the street where you can see them, but they are in their car and, showering at the gym, or you have people who are couch surfing, right? And so you have families, multi-generational, who are all living in a place that may just have 1 or 2 bedrooms because individually housing is unaffordable for them. And that housing affordability gap is getting bigger and bigger for families here in the Coachella Valley. And all of this intersects directly with healthcare, because when you're trying to survive, when you're trying to figure out housing, you're trying to figure out food, you're trying to figure out childcare, oftentimes your health will take a back seat, right? And so those are the things you mentioned, as well, the social determinants of health. And so we've learned, there have been so many studies done about this, that all of these things work together. So we don't want to just focus on one aspect of it. We need to make sure that we're focusing on every aspect so that individuals can have the best quality of life here in the Coachella Valley, and that access to healthcare should not be something that is a barrier. It should be something for everyone, no matter where you live, no matter how you identify, no matter how much money you have, you should have access to good, safe healthcare.
Absolutely. And that's well said. And I appreciate and thank you for sharing your perspective and your experience, because we appreciate the tourism in Coachella. Please keep coming.
Yeah.
And
keep
enjoying
coming.
the valley. But we also want you to know that there are people with real lives here, real challenges. Healthcare is one of them, those other social determinants of health. And I think what your experience does as well, it speaks to these great organizations, like you mentioned, in Coachella Valley Rescue Mission and Martha's Village and Kitchen. They're doing really great work that impacts people's lives in a positive way. So my last question for you is, and maybe it's hard to name one thing, but what is the one thing that you are most proud of in your life?
Yes.
That's a big one.
That was a tough one, I'm so grateful. I'm so blessed. I have so many things to be grateful for. And I thank God for the opportunities that I have had here that have been afforded to me, the support that I've received. But I would say one of the things that I'm proudest of is my recovery and the individuals who I've met along the way, the experiences that I've had being in recovery, and also the work that I get to do now to pay it forward, to help another person who may be struggling, because once upon a time, I was there too. And so I would say that for me is something that I'm very, very proud of, because you have a lot of individuals who have overcome so much, who have been through so many things. And one thing I've learned as also a person who has had to overcome a lot is that we don't do it on our own. We do it as part of a community. And the community here in the Coachella Valley is so strong. You have so many nonprofits and, other organizations who are there and willing and ready to help. And they're able to do that partially because of funding from government institutions and other entities, but they're able to provide those services and make sure, to the extent that they can, that nobody falls between the cracks, that nobody is left behind, that nobody is forgotten, and that the dignity and value of each person is respected. And so that for me is something that I believe that my recovery and my experience being in recovery has really, really shown me again and again and again.
Right. Congratulations on your recovery. Continued success.
Thank you.
Absolutely.
Thank
you. For those who are watching or listening, you can learn more about Anyse and the rest of the board, as well as the district and foundation at dhcd.org. Anyse, thank you so much for being with us today.
Yeah, absolutely. It was a pleasure. Always enjoy speaking with you, Will.
All right. Thank you. Take care.
Okay. Thank you, you too. Bye-bye.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.